very important that you maintain good hand hygiene when you're wearing a splint, and it really depends on the clinical situation as to how best to do that. For some patients, they're going to be asked to never remove their splint and to not use the hand whatsoever. For some patients, they're going to be able to use part of the hand, as you would see in this situation here, where you cannot use your thumb, but you may be able to use the unaffected fingers. And for some patients, they're going to be able to completely remove the splint and perform normal hand hygiene with soap and water and or hand sanitizer. You maintain good hand hygiene with your splint on by first of all looking after the area that is uninfected. So you can use hand sanitizer on this area or soap or water, provided you don't allow that water to get into any wounds. With your splint, you can keep your splint clean by using a hand sanitizer on the outside of your splint and asking your therapist for a second set of straps. If you have a second set of straps, one set of straps can be removed every day and placed into the washing machine on a hot wash and a fresh set of straps applied. This allows you to maximize your hand cleanliness during a period when you are required to wear a splint full time. In the situation where your treating therapist and or surgeon has said that it is safe for you to remove your splint, you can simply remove your splint and wash your hand with soap and water at home in the same way that you would standardly wash your hand to maintain hand sanitisation. It is also possible to wash your splint as you would your hands. For 20 seconds. It's generally better to use cold soap and water in this scenario because the water will penetrate the perforations on the thermoplastic and is more likely to be able to clean in that area than a hand sanitizer on the surface. Often people use toothbrushes to help to get into the space. In the scenario where you have a splint that it is essential that you continue to wear 24 hours a day, you may have two different situations. One where part of your hand is safe to use and to clean, and another part of your hand that may not be safe to use. In the scenario where you've got a component of your hand that is safe, you can continue to wash that area with cold soap and water as in a standard hand hygiene, and you can use those fingers to continue to maintain standard hygiene on the rest of your hand with either hand sanitizer or soap and water. In a situation where you've been advised not to remove your splint by your surgeon or treating therapist, it's important to continue to maintain hygiene of the exterior of the splint. The simplest way to do this is to ask for your therapist to provide a second set of straps. This means that you can gently remove the straps, place them into a washing machine on a hot wash. The surface of the plastic, whilst it's intact with your skin, can be cleaned using a general alcohol wipe to cover the surface of the splint. If you have a wound underneath the splint that is continuing to be cared for, just ensure that you don't have additional liquid from the wipe that penetrates through the splint onto the dressing or the wound. If you have a completely healed hand or skin intact underneath, it may be possible to use a spray sanitizer to the outside of the entire splint. If you have any questions about the safest technique to manage hand hygiene during this period, please contact EKCO Hand Therapy.